Well, I'm hoping that the role of immunotherapies will be increasing also in the field of hematology. So we've known for decades that hematological cancers are very sensitive to immune modulation. We know that from the transplantation studies and treatments, but also from vaccine studies and the use of interferon alpha. So I'm really looking forward to the advent of the checkpoint inhibitor studies, for example, for acute leukemias and other forms of hematological cancers. I think currently the most urgent unmet need for new treatments in hematological cancers is in acute leukemias, especially in acute myeloid leukemia, in which we haven't had a new drug registered now for more than 30 years. And the outcome of those patients is still very poor. But there are other forms of hematological cancers like myeloma, multiple myeloma, but there are new drugs coming for that disease. So I would say that, like I said, the acute leukemias are the really in burning need for new treatments. The most encouraging possibilities for cancer care today are the combinations of immune treatment, immunotherapies to targeted agents. And those studies are only in the beginning, and there's a lot of room where we can really use best of these both worlds. So directly targeting the tumor cells, the cancer cells, and then supporting the body's immune defenses to reject the tumors. And I'm quite sure that the combination will be the key to success in cancer treatment. We are doing research on acute leukemias, so we are trying to stratify acute leukemias into small biologically defined groups, and then we are trying to find new drug targets for these very small groups of patients. Because that is the future of cancer, that almost all the cancers will be very rare diseases because they are so different even within single cancer group. And so that's one focus, and the other focus is on developing immune treatments for hematological cancers. And we've started now working first with CML, but also with other hematological cancers. I'm hoping that as we need new treatments for many of the diseases that we have at the clinic, so I'm hoping that the impact of our research will be that we would, at least in this very small proportion of patients, that we would find at least a couple of new drug candidates which we can then move forward to formal clinical studies.